This is Scott Becker with the Becker's Healthcare Podcast. Thrilled today to be joined by Michael Sanborn. Mike is the president and CEO of Baylor Scott & White All Saints Medical Center. He's going to talk to us about what he's seen the last couple of years, how we've seen strategy evolve, big priorities today, and a little bit more. Mike, can you take a moment to introduce yourself?
Thank you, Scott. Mike Sanborn, and I'm actually a pharmacist by training, but have not practiced pharmacy for a long, long time, been in administrative roles for most of my career. I've been with Baylor Scott & White since 2003, and initially managing the pharmacy enterprise and then cardiovascular services after that, and then served as the president of one of our other hospitals before moving here to Baylor Scott & White All Saints in Fort Worth about almost 5 years ago now.
And so let me ask you a question, because you made the transition from pharmacy and business in the early 2000s into health system leadership. What was that transition like? How did that go? What was that like?
You know, it was interesting. I never dreamed of or thought about moving into a leadership role outside of pharmacy, and was approached by one of our senior leaders many years ago. And he said, hey, we've accomplished a lot in pharmacy. I need for you to do the same thing on the cardiovascular side. And initially I declined that job opportunity, and he was persistent and came back and said, I really think you should do this, and it would be a great career opportunity. And so, I decided to kind of step away, and it was very difficult. I've stayed connected with my pharmacy folks, but have really enjoyed the leadership aspect of things. And I think just an opportunity to create more just opportunities for the people that I work with on a broader scale.
Thank you. And Baylor Scott & White, magnificent system. Talk about how you've looked at strategy the last couple of years, what you've learned, what's changed. Take a moment there.
Yeah, I think, we've obviously been very focused on, a lot of different things that have certainly helped us through the pandemic, and that forced a shift for sure in a lot of the things that we do. But as an example, our organization had been really focused on developing app-based communication with our patients that we serve. And that was instrumental in part of the changes that we had to address when the pandemic started with virtual visits and everything. We had the platform all set up for that. Basically, we just instructed our patients to text the word better to 88408, and they would get an invitation to join the app or to set up their app, and then we could coordinate testing, we could coordinate virtual visits, we could coordinate office visits, we could coordinate everything. And so, I think that whole virtual aspect as a focus for us over the last several years really served us well. But then, I think certainly over the last 18 months, the pandemic has really changed everything. If you would have told me 18 months ago that something was going to happen that would literally affect every single way that we delivered care, every single employee, every single physician, it would have been hard to believe. But boy, that certainly has. And I think we've been able to address that in a variety of different ways. Our focus initially, of course, was taking care of our staff and our medical staff and making sure that they had the appropriate equipment to keep them safe, but also the appropriate procedures in place to keep them safe. And the patient education that was necessary related to the pandemic, we'd always done a lot of patient education and a lot of resources out there related to patient education about various disease states, but it became a much more acute. And so it was fortunate that we had that foundation in place in order to really push out information about the virus, about how to keep yourself safe, all those different things. And, I think a lot of it really, too, has just been focused on how to effectively take care of that. Our hospital was the first hospital in DFW, for example, to use the monoclonal antibodies. And it was fortunate that we had a very strong clinical infrastructure that was on the front edge of that to be able to understand where they need to be applied, how they needed to be applied, what the FDA restrictions were on that. And so it seemed like we were ready for everything before it happened because of a lot of the strategies that we had in place prior to the pandemic.
When you look at now, as you're middle of 2021 or almost the middle of it, what are the three big priorities this year? What are the three big priorities that you're focused on?
Well, for us here at the hospital, we are in the process of converting and transforming into a university teaching hospital. So that's a number one priority for us right now. We are doing that in partnership with the TCU and UNT Health Science Center College of Medicine, which started 2 years ago. They're moving into their third year. And we are starting a residency program in partnership with the College of Medicine and welcoming our first 15 internal medicine residents on June 28th. And then we'll be adding next year an OBGYN program, residency program, a transitional year program, and a emergency medicine program, followed by surgery, followed by anesthesia. So when it's all said and done, we're going to have north of 150 residents training here when all of those programs fill up. And so it really is exciting. There's a tremendous amount of medical staff enthusiasm, a lot of community excitement about the partnership with TCU as well as the residency program in general, because it's desperately needed in Fort Worth just because of the general need and the physician shortage that we have. So that's certainly a big focus.
That's a huge priority. I mean, that's a huge priority. It's overwhelming and exciting and so needed.
It is. And another big priority for us, we've always focused here for the last several years on providing comprehensive services in four major service lines: cardiovascular and vascular services, women's health, and transplant, and oncology. And our focus is a little different than some of the other local hospitals in that we've really tried to provide advanced therapies. And so we continue to roll out and expand new programs in advanced heart failure. We'll be placing the first ventricular assist device in Tarrant County coming up later this year. We have our survey coming up for the VAD program here shortly, but also developed a lung surgery program so patients don't have to travel out of the city for lung anymore. Comprehensive cardiovascular services, specifically around cardiac surgery, complex valve surgery, aneurysms, those types of things. And so our focus really, and that hasn't changed throughout the pandemic, has really been to expand those four service lines and make sure that we're meeting the needs of the community and meeting the needs of the medical staff in the area so that patients don't need to leave town in order to receive care.
Fantastic. And talk about, and it probably rolls into the first thing you spoke about, but what are you most excited about this year as you what are you most excited about currently?
Well, I think it's great to be in Fort Worth. It is by itself the 12th largest city in the United States and one of the top 5 fastest growing major cities in the United States. And so there's a lot of growth and expansion in Fort Worth, which makes it an exciting place to be. But I think more importantly, meeting the healthcare needs of the community has never been more important in a community that's growing as fast as we are. And so really working with city government, Tarrant County, has really been exciting and a great opportunity. I think the collaboration with the other hospitals in the area that was always strong, but certainly was strengthened throughout the pandemic, that has been of interest. I always kind of joke that we compete more like sports teams compete. Rather, we're not trying to put each other out of business. We're trying to make care better in the city. And I think that partnership is certainly fantastic. And so, it is definitely about, our transformation to a university teaching hospital that I think is most exciting, but also what that means for the community and the patients that we serve.
If you could, to use the sports team analogy, one, becoming a university teaching hospital is magnificently exciting. If you could do me a small favor, though, if you could talk about this concept, the Green Bay Packers seem intent on putting my Chicago Bears out of business. If there's any way to get them to be a little kinder and nicer to my Chicago Bears, I would appreciate that greatly.
Yeah, absolutely. I'm just hoping that the Cowboys show up this year and we've got a decent team. But yeah, I'll see what I can do to help you there.
I appreciate it. No, thank you so much. But your point is well taken. It's like sports teams. If one's out of business, they're all out of business. They got to play against each other. There's an old adage about lawyers. If there's two in town, they both do great. If there's one in town, he or she gets killed. But it's a fascinating collaboration that's emerged amongst health systems and so forth, and so important for so many reasons. I appreciate, Mike, you taking the time to visit with us today in the Becker's Healthcare Podcast. Just a great career, and thank you for taking the time to visit with us.
You bet. Thank you, Scott. I appreciate the opportunity.